Hello everyone, welcome to LUMP Continuing Acupuncture Education. Today we feature Heart Yang Deficiency. Heart Yang Deficiency and Heart Qi Deficiency have a lot of symptoms and signs in common. Heart Yang Deficiency will, though, manifest with characteristic Yang Deficiency symptoms and signs. Heart Yang Deficiency can be a consequence of Yang Deficiency conditions in other organs, such as the kidneys and the spleen. Heart Yang Deficiency can arise after a person has been sweating profusely. This will weaken the heart's Yang aspect. It can also arise when there have been other types of excessive fluid loss, such as severe diarrhea, vomiting, or bleeding. Furthermore, etiological factors that may lead to spleen and kidney Yang deficiency can also be relevant. This could be things like overwork, too much sex, disease, old age, congenital weakness, and excessive intake of cold food, cold drinks, and cold medicine. Some of the symptoms are the same as for Heart Qi Deficiency: palpitations, shortness of breath, tiredness, sweating, and pale face. This is because Heart Qi Deficiency could be considered as included within Heart Yang Deficiency. In other words, it is not possible to have a deficiency of Yang without a deficiency of Qi. Feelings of cold and cold hands are due to Heart Yang not transporting blood to the extremities to warm them. The slight feeling of stuffiness in the chest region is due to Heart Yang not moving Qi in the chest, and hence leading to a slight stagnation of Qi in the chest. Bright pale face is typical of Yang deficiency. In Blood Deficiency, the face would be dull pale. The lips are slightly dark because deficient Heart Yang fails to move Qi and blood, and this may cause a slight blood stasis. Please note that this sign would appear only in severe and advanced cases of Heart Yang Deficiency. The tongue is pale because Heart Yang cannot transport enough blood to the tongue, and it is slightly wet because Heart Yang cannot transform the fluids, which therefore accumulate on the tongue. The deep and weak pulse reflects the deficiency of Yang. A knotted pulse, a slow pulse that stops at irregular intervals, might be found in severe cases. Heart Yang Deficiency may derive indirectly from a chronic deficiency of kidney Yang, as kidney Yang is the source of all Yang energies of the body. The stomach and spleen also influence the heart directly, and a deficiency of Yang of the stomach and or spleen is a frequent cause of Heart Yang Deficiency. Heart Yang Deficiency may develop also from Heart Qi Deficiency. The most clinically important potential consequence of Heart Yang Deficiency is heart blood stasis. Deficient Heart Yang fails to move Qi in the chest. This may lead first to Heart Qi Stagnation and then to heart blood stasis. This pattern is clinically important because it is involved in Western medical diseases such as angina pectoris and coronary heart disease. Symptoms and signs: slight shortness of breath, fatigue, depression, spontaneous sweating, palpitations, chest oppression, cold hands, aversion to cold, pale or white face, slightly dark lips, lack of enthusiasm for life, mental lethargy, slow speech, poor posture, pale, wet, swollen tongue, slow, deep pulse. The pulse may be weak in the left Sun position. Key symptoms: palpitations, cold hands, deep and weak pulse. Treatment principle: warm and tonify Heart Yang. Acupuncture points: choose from Heart 5, Heart 7, Bladder 15, Ren 14, Ren 17, Ren 6, Do 4, Do 14, and Pericardium 6. Needle technique is tonifying technique. Moxa is recommended. Heart 5, Heart 7, and Ren 14 tonify the Heart Yang. Bladder 15 tonifies Heart Yang if Moxa is used. Ren 17 tonifies Qi and Yang in the upper jaw, tonifies Heart Yang if Moxa is used. Useful if there is stuffiness of the chest. Ren 6 with Moxa tonifies all Yang energies of the body. Useful if Heart Yang Deficiency results from kidney Yang Deficiency. Do 4 tonifies Yang. Do 14 with direct Moxa tonifies Heart Yang. Pericardium 6, Heart 5 tonify Heart Qi. Heart 5, Tong Li, connecting interior. Location on the palmar aspect of the forearm. The point is on the radial side of the tendon of the muscle flexor carpi ulnaris. Classification: luo connecting point of the heart meridian. Heart 5 is a very good point to tonify Heart Qi. Luo connecting points of one meridian can communicate with two meridians. They treat diseases of the collaterals and can be used to treat chronic diseases, especially chronic diseases of the Zangfu organs. Clinically, luo connecting points are often combined with yuan source points in the treatment of diseases. Needling, perpendicular insertion, 0.3 to 0.5 Tsun. Indications for Heart 5: sudden loss of voice, stiffness of the tongue, pain in the wrist and arm, palpitations. Functions: calms the shen, benefits the tongue, regulates heartbeat. Heart 7, Shenmen, spirit gate. Location: on the wrist, at the ulnar end of the transverse crease of the wrist, in the depression on the radial side of the tendon of muscle flexor carpi ulnaris. Classification: yuan source point of the heart meridian, shoestring point of the heart meridian. Heart 7 is the point for emotional issues, especially excessive anxiety and worry. Clinically, yuan source points are of great significance in treating diseases of the internal organs. Yuan source points are the sites where the yuan or primary qi of the Zangfu organs passes and stays. Needling the yuan source point stimulates the vital energy of the regular meridians, regulates the functional activities of the internal organs, reinforces anti-pathogenic factors, and eliminates pathogenic factors. This method of treating diseases deals principally with the root causes. The yuan source point from the affected meridian is often combined with the luo connecting point of the internally-externally related meridians in use. Shoestring points are where the qi starts to pour down the meridian. They are known to alleviate heaviness and pain in the joints. On yin meridian, shoe stream points are identical to the actions of yuan source points. Needling, perpendicular insertion, 0.3 to 0.5 tsun. Indications of Heart 7. Insomnia, amnesia. Cardiac pain, palpitations due to fright, irritability, chest pain. Mania, epilepsy, stupor. Functions, calms the shen, tonifies and regulates the heart blood and qi. Ren 14 or CV14. Chu Che, Great Palace. Location on the anterior median line of the upper abdomen, 6 tsun above the umbilicus. Classification, front mu point of the heart. Front mu points can be used to treat diseases of the affected Zangfu organ and those of yang meridians and collaterals. They treat diseases of 6 fu organs and diseases of yang meridians. An adverse reaction when a front mu point is pressed can help make a diagnosis. Needling, oblique insertion downwards, 0.5 to 1 tsun. Indications of Ren 14, pain in the cardiac region and chest, palpitations, manic psychosis, epilepsy, gastric pain, vomiting. Functions, opens the chest, transforms phlegm, regulates the heart, calms the shen, subdues rebellious qi. Bladder 15. Shin Shu, Heart Shu. Location, on the back, 1.5 tsun lateral to the lower border of the spinous process of the 5th thoracic vertebra. Classification, bakshu point of the heart. Bladder 15 is one of the best points for insomnia and anxiety, especially if the pattern is due to heat. Bakshu points are corresponding points on the back where the qi of the respective Zangfu organ is infused. If the 5 Zang organs are diseased, abnormal reactions appear on the bakshu points. Bakshu points have a direct therapeutic effect on the diseases of the 5 Zang organs. Needling, bladder 15, oblique insertion, 0.5 to 0.8 tsun. Indications, cardiac pain, palpitation, chest congestion, shortness of breath, cough, hematemesis, insomnia, forgetfulness, epilepsy, nocturnal emission, night sweating. Functions of bladder 15, strengthens and nourishes the heart, calms the shen, regulates heart qi, opens the chest, resolves blood stagnation, clears heart heat or fire. Ren 17 or CV17. Shan Chung, chest center. Location, on the anterior median line of the chest, at the level of the 4th intercostal space, at the midpoint between the 2 nipples. Classification, front mu point of the pericardium, converging point of the qi. Needling, subcutaneous insertion, 0.3 to 0.5 tsun. Indications for Ren 17, asthma, pain and oppression of the chest, cardiac pain, palpitations, insufficient lactation, hiccup, dysphagia. Functions, opens the chest, tonifies and regulates lung qi, subdues rebellious lung qi, benefits the breasts. Qi high. Qi high, Qi high. Indications for conception vessel 6: abdominal pain, diarrhea, constipation, enuresis, hernia, spermaturia, impotence, irregular menstruation, amenorrhea, emaciation due to consumptive disease. Functions: strengthens kidney qi and yang, regulates qi, benefits original qi, treats prolapse. Du4 or GV4, Mingmen, Gate of Life. Location: on the lumbar region, on the posterior median line, in the depression below the spinous process of the second lumbar vertebra. Du4 is one of the most effective points to tonify yang and strengthen the constitution. It is especially efficacious if moxa is also used on the point. Needling, oblique insertion upward, 0.5 to 1 tsun. Indications for Du4: spermaturia, impotence, irregular menstruation, leukorrhea, diarrhea, stiffness and pain of the lumbar. Functions: tonifies kidney qi and yang, tonifies original qi, nourishes essence, clears heat, strengthens the lumbar region and knees. Du14 or GV14, Ta Choi, great vertebra. On the posterior median line, in the depression below the spinous process of the 7th cervical vertebra. Classification: crossing point of the 3 yang meridians of the hand and the 3 yang meridians of the foot. Du14 is one of the most important points to release the exterior and treat wind heat, cold or flu. It's also a main point in treating summer heat. Needling, oblique insertion upward, 0.5 to 1 tsun. Indications for GV14: febrile disease, malaria, hectic fever, and night sweats. Aversion to cold, common cold, redness, swelling and pain of the eye, neck rigidity and pain, epilepsy, cough. Functions: clears heat, releases the exterior, dispels wind, regulates wei and yin qi, treats malaria. PC6, Nei Guan, inner gate. Location: on the palmar aspect of the forearm, 2 tsun above the transverse crease of the wrist, on the line connecting PC3 and PC7, between the tendons of the muscles palmaris longus and flexor carpi radialis. Classification: luo connecting point of the pericardium meridian, master point of the yin wei vessel coupled with spleen 4. PC6 is an extremely popular and useful point. It is very helpful in treating insomnia and calming the shen. It also is the point to use for nausea and vomiting. Furthermore, it can be used for any condition related to the chest. Needling, perpendicular insertion, 0.5 to 1 Cun. Indications for pericardium 6, chest congestion, pain in the hypochondrium, cardiac pain, palpitations, epilepsy, vomiting, hiccup, depression, dizziness, vertigo, apoplexy, hemiplegia, spasm and pain of the upper extremities, cough, asthma, irritability, malaria. Functions: opens the chest, regulates heart qi, calms the shen, harmonizes the stomach, relieves nausea and vomiting, regulates qi. It is important that yang is protected and not further burdened when there is Heart Yang Deficiency. This means that the patient should avoid consuming food and beverages that have a cold energy or temperature. At the same time, they must not overexert themselves, and men should avoid having too much sex. Heart yang can be damaged by excessive sweating. Therefore, saunas and steam baths are something that is not recommended for these patients. Heart Yang Deficiency can be caused by the following patterns of imbalance: Heart Qi Deficiency, Kidney Yang Deficiency, Spleen Yang Deficiency. Heart Yang Deficiency can result in the following patterns of imbalance: Heart Yang collapse, phlegm obscuring the shen, heart blood stagnation, Qi stagnation in the chest, Kidney Yang Deficiency, overflowing water. Heart Yang Deficiency in a nutshell. Etiology: repressed emotions, chronic illness, blood loss, excessive sexual activity, retention of dampness, overwork, old age. Underlying or accompanying pathology: Kidney Yang Deficiency, Heart Qi Deficiency, Heart Blood Deficiency. Signs and symptoms: palpitations, breathlessness, on exertion, feeling of oppression, possibly pain in the chest, worse from exertion, feeling of cold, cold hands and feet, fatigue, slight depression, spontaneous sweating, bright pale face, slightly dark lips. Pulse, deep and weak. If severe, it may be knotted. Tongue is pale and soft or pale green-blue. Treatment principle: warm and supplement Heart Yang, calm Shen, supplement kidneys to support the heart, Shao Yin. Acupuncture treatment: Heart 5 to supplement Heart Qi, pericardium 6 also to supplement Heart Qi, bladder 15 to supplement Heart Yang with moxa, Ren 17 unbinds chest, Ren 6 supplements Yang of the whole body with moxa, 214 supplements Yang with moxa. Ren 14 clears heart, stabilizes Shen. 2-4 secures the essence, regulates Qi. Heart 7 quiets the heart and Shen. Needle with supplementation or tonification and moxa. For blood stasis, you may want to add bladder 17. liver 3, spleen 6, which is snidled with even method. Thank you very much for your attention. See you in our next videos.